Welcome to my educative channel. I'm Dr. Ricardo Hoogstra, plastic surgeon, Buenos Aires, Argentina. I'm specialized in facial rejuvenation, minimal invasive rejuvenation, and I develop a lot of technique of periorbital rejuvenation without skin resection. I can say from here, from the cheek to here, I rejuvenate all this area without removing skin. I perform the brow, periorbital rejuvenation with laser. I developed a technique that do not need to remove skin. There is an interrelationship between the eyebrow and the upper eyelid. If the eyebrow is down, the upper eyelid is not good. Also there is an interrelationship between the lower eyelid and the cheek area. If the cheek have no volume, the lower eyelid is going down. For this reason, it's very important to increase, improve, or fill the cheekbone, the malar area with fillers in young patients which they lack for an ethnical or racial question. They lack volume and they have dark circles. Is just with a filler in this area I can improve. But when we get older in the aging process, we lose volume here and the cheek is flattened and the lower eyelid is going down. Here we can see then the title is improving the beauty of the lower eyelid, meanwhile increasing the volume of the cheekbone volume. This is my curriculum. This patient have a conventional upper and lower eyelid blepharoplasty. You can see the natural result, the sclera show, but the medical doctor that performed this procedure don't put attention in the lack of volume of the cheekbone, in the also the malar area. We can see a flattening here, and you can see the sclera show and the flattening in this area. All this area lack of volume. The patient come to see me because he saw in my videos that I perform carbon dioxide laser to improve this, but my suggestion was to improve at this moment of the consultation the malar area, the cheekbone, to get balance in the face, because it's very important the cheekbone volume in relationship with the chin and the jaw. Here we can see the lack of volume, the flattenness. You can see here the lower eyelid is here because they have no volume, and this is the immediately result. This procedure take me 10 minutes, just an ice here, and I perform 2 fillers, 1 cc of heavy chain of hyaluronic acid. In this case I inject Voluma, and you can see the lower lid cheek junction is here, and now the lower lid cheek junction is here. And the importance of the volumination at the nice of the malar area, the cheek, how improve the lower eyelid. Just all this unit improve a lot just with the simple 2 injection of hyaluronic acid, and how improve this area also. And you can see the big change. You can see here, and also how improve the sclera show with this kind of voluminization. This is very nice. The balance of the face with the volume of the cheek, the volume of the zygomatic arch, how shortening the lower eyelid, and how improve the full balance of the face. We can see here in the profile view how improve the malar area, how we can see a flattening here, and we can see projection here that improve the full balance of the face, not only improving the beauty of the malar area, improve the beauty of the lower eyelid, shortening the lower lid cheek junction, because the young patient, the beauty patient, have a big volume of the malar that continue with the lower eyelid. Here that is a flattening. Okay, you can see is another person. Just 10 minutes, no pain, no downtime, but to produce this is needed a lot of skill with the filler, but also a lot of skill with the anatomy. I'm general surgeon, plastic surgeon, aesthetic surgeon. I know where I need the patient need the filler, the injection, and this is the result immediately after the procedure. Okay, I hope you enjoyed this presentation. Have a nice day.